Hi, this is Matthew Hammond with Carrot Eye Center. I'm excited that you stopped by our website to get a look at who we are and what we do. I love talking about LASIK, so I'm just going to take a quick second here and walk you through what a typical LASIK procedure sort of on the day of surgery would look like. So first, you've come in already for your consultation where we've done extensive testing and making sure that you're a good candidate. I've recommended a procedure for you that then you've chosen. Well, we've gone through the risks and benefits so that you understand everything. Now, day of surgery. So on the day of surgery, all the payments, all that stuff will have already been taken care of. So you come in stress-free. We'll give you a little Valium so you're nice and comfortable. And then we'll take you back to the LASIK suite. Now in the LASIK suite, we'll put a little hat on, some little booties to make sure you're all as clean as possible. Wash your eyes to make sure that they're clean. We'll put some little tape on to keep your eyelashes out of the way. And you'll just simply lay down on a little soft, comfortable bed. We'll give you something to squeeze with your hands so your hands are occupied. And usually a little warm blanket so you're nice and comfortable. The first step of the procedure, we'll apply a little laser that will make the flap of eye skin. Sometimes you'll feel a little pressure, maybe a little pinch here or there. I will certainly warn you ahead of time so you're aware and understand that. Takes about 8 to 10 seconds per eye. We'll move you over to the second laser where we actually correct your vision. At that point, I'll lift up that little flap very gently. You won't feel anything. Again, maybe a little pressure. You'll look at a green light for about 8 to 10 seconds while the laser is applied to the eye and it corrects your vision. Now, sometimes you smell a funny smell during this part. And everybody says, oh my goodness, my eye's burning. Well, there's no heat to any of these lasers. And as the laser flies through the air, it actually creates ozone, and ozone has a funny smell. I call it the smell of good vision. So if you smell that, don't worry. That's just part of the procedure, and it's completely normal. After the application of the laser, I'll gently put the flap back down, dry it all off, make sure it's nice and positioned well. We'll put some medicated eye drops in, and then I'll have you stay in the clinic for about 15-20 minutes to make sure everything's good to go before you leave. Now, for about 3 or 4 hours after the procedure, your eyes will sting and burn a little bit and water. We'll give you some Tylenol PM before you leave the clinic because I want you to go home and sleep. If you sleep, you'll sleep right through it. If you don't, it can be a little burny, maybe a little stingy or teary for a few hours. But after about 3 or 4 hours, that's it. Your vision will start to gradually clear through the day, and by that evening, you'll see quite well. By the next day, you're pretty much good to go. And within 2 weeks, that nice, clear, crystal clear vision is there for you. So the procedure is very simple, straightforward, and easy for you. That's why I love LASIK, because it's so easy for you and it's super fun to do. So if you have any questions, feel free to call us anytime. Send me a text, send me an email. I love talking about LASIK, and I look forward to seeing you. So if you haven't already made your consultation, it's free. Call today. I'd love to see you and talk to you about how I can help you get the best vision that you want without glasses and contacts. Looking forward to seeing you here at Carrot Eye Center.